Today we will be talking about graft-versus-host disease, and 50 to 60% of all transplant recipients are affected by that, and in 1/3 of all the patients they do not respond on the treatment with steroids, so we call them steroid refractory GvHD patients. And so far there is no licensed drug to treat this patient group, and so they do carry a higher risk not to survive this complication. And this conference, as the last conferences as well, it's always a hot topic to talk about. And here, especially at the EBMT meeting in Frankfurt, there were several sessions dedicated to this hot topic. And this early morning, for example, there was an educational meeting where we discussed other treatment options to cure patients with steroid refractory GvHDs. And so we discussed the use of JAK inhibitors 1 and 2, and Bruce Blazar presented these data and showed promising results in part. However, they are often associated with substantial side effects like neutropenia, aplasia in the patient, and viral reactivation and viral diseases. Other options, and there are quite a few, are monoclonal antibodies, but also there, as these monoclonal antibodies are directed towards T cells, they send them into apoptosis and create a substantial T cell deficiency, which is then associated with very much increased risk of infectious death and complications. The further option were the discussion about mesenchymal stromal cells, and this was a presentation I have had the honor to do so. And we have developed a new method for generating mesenchymal stromal cells pulled out of mononuclear cells, so could measure that they have a standardized potency. And first clinical treatments I presented 60 data. We will be presenting an update on Wednesday morning. Over 92% we could show a substantial improvement in survival with only very little side effects. And the further treatment option is the ECP, electrocorporeal photopheresis, and the presentation was given by Hildegard Kreinix, showing also good efficacy for patients with steroid refractory GvHD if they are not too advanced, is what she said. And in these patients you can really see an improvement. However, not for all those patients with really aggressive grade 3 and 4 steroid refractory diseases.